stuff. Alright. Okay. So, with the cat in the sternal recumbency, you want to palpate the space between the sacrum and the first coccygeal vertebrae. You'll lift the tail dorsally to facilitate location. Again, this cat has a pelvic fracture, so the anatomy is not quite normal. Sorry, buddy. He has been lightly sedated with some hydromorphone. Identify the widest space between the sacrum and the coccygeal vertebrae. It's a little more cranial than it usually is, but right about there. Using a 25 gauge, 1-inch needle, you penetrate the skin at midline. Sorry, buddy. Direct the needle at a 35 to 45 degree angle cranially and continue through the inner arcuate ligament. There's a pop when the ligament is penetrated. So you advance it, there should be no resistance upon entering the epidural space. If bone is encountered, keep the needle in the skin and slightly angle the needle cranially or caudally off the bone until the space is entered. It feels more firmly seated once the ligament is penetrated than it does in the subcutaneous tissues. The space penetrated may be between the first and second caudal vertebrae, and this is okay. Attach the syringe, aspirate to confirm abscess of blood. Infuse 0.1 to 0.2 mils per kg, 2% lidocaine, about a half a mil per cat. There should be no resistance for the injection. Withdraw the needle and observe for rectal or tail relaxation. The tail should go limp. And should be relaxed. At this point, it is much easier to extrude the penis and unblock the cat.